KO has a program here known as the Harry E. Goldfarb Directorship. And I would understand how a lot of students and adults around here hear names all the time and we don't really think so much about them. We have the Roberts Building, and we have the Hoffman Field, and we have the Goodman Banks Visiting Artist, etc. And sometimes we don't think so much about the names. So if I could just take a little bit of time to say, oh, history department excluded, they know everything about the names. But the rest of us sometimes go through our day without thinking about this. This was named after Harry E. Goldfarb, who sent his kids to KO in the 60s. And a lot of families would do this kind of thing based upon good experiences and the fact that his children wanted to honor their father for sending them to KO. They have sponsored, that would be William H. Goldfarb, who was a class of 1964, and his brother Robert actually sponsored this directorship in honor of their father who sent them here to KO. So when you hear these names, just know that there's something behind that. And today, they have given us the opportunity to meet Dr. Henry DePhillips, who is a KO grad in 1978. He graduated from here, went on to Trinity College, majored in biochemistry, and then got an MD at Hahnemann University in Philadelphia, Pennsylvania. For 10 years, after he became a doctor, he did the family practice thing. He was delivering babies, and according to his bio, making house calls, which makes you about one of the last people that ever did that, so thank you for that. He decided then to get into medical management, and he has a very impressive list of consulting and leadership roles. Currently, he is the Executive Vice President and Chief Medical Officer for a company called Audex Health, and he specializes in the integration of social media, other technological applications, and healthcare. And I'm pretty excited to hear about this. Right now, he lives in Tennessee. He hasn't been back to KO for a long time. He's married with 4 children, has a lot of interesting hobbies, and is writing a book. I try to tell my students this all the time. Just one last thing. Scientists are artists, and artists are scientists. Please help welcome Dr. Henry DePhillips.
Thank you. That's a phenomenal introduction. Good morning. How's everybody doing? Mr. Keif, how are you? It's good to see you. I think there's all of like 3 professors here that were here when I was here, because it was really a long time ago. Thank you, Mr. Goodman, for that kind of introduction. This is going to be a little bit of a different presentation than you've probably ever heard before. And with all due respect to Mr. Goodman, you're going to find out that I think a little bit differently than most people. And I hope to share some of those crazy thoughts with you today. Take what you like, leave what you don't. But I think everybody will go out of here with hopefully a slightly more open mind. Who has an iPhone or a Droid or a BlackBerry on them? Okay, take it out. What do most people say at this point? Most people say what? Turn it off, right? Turn it on. And I'm quite serious. Turn it on. How many people are on Twitter? Okay, go to Twitter. My Twitter handle is @Henry436, and the first person that goes to my Twitter account, reads my most recent tweet, which was yesterday afternoon, raises their hand and tells me how I feel right now, because it's in there, will get some kind of prize. I don't know what it is yet, but I'll figure that out. So go for it. Did you say it first? If you ever want to be nervous, try graduating a school 34 years ago and coming back and standing on the stage. I am nervous beyond what you can imagine. And I talk to executives all day long. Anyway, thanks for being here. By the way, don't turn those off. It's probably a good idea to not let it ring, and it's probably a good idea to not actually take a phone call. But other than that, just leave it on, and we're gonna come back to those things in just a moment. So, as you heard, I went to college right up the street at Trinity, and then went to medical school in Philadelphia. I had a fairly traditional career path, one that perhaps many of you are pursuing. And then something happened, and it has to do with sort of how I think and how I approach things, and it got a little crazy, and I wound up in a place that I never in a million years would have dreamed about. But I got to tell you, I am having more fun now than I have had in a really long time at work. It's a lot of fun, and we'll get to that. So this is, and remember, I'm just one graduate of this school, so this is my journey. I'm just going to share it with you. Again, take what you like, leave what you don't, and you know, hopefully you'll learn something from it. And hopefully it won't be boring. So first I have to give thanks. How many people in here know any Latin? Okay, so see the people with their hands up? You have to ask them what the first thing means. That's first for me. My family, of course, would not be here. My folks are actually in the audience today, which takes the nervousness level up even further. Believe it or not, the way I got on this stage was my company launched a platform last month, and it's doing really well, I'm glad to say, and none other than Debbie Hyde, who I had never met before, found me on the internet because I do a lot of the public speaking and related to our company, and she called me up totally out of the blue and said, would you come back and do this talk? And I said yes, of course, and I was up at 4 in the morning the next morning writing this about 5 weeks ago. So Debbie, thank you for finding me on the internet. It's a sign of the times, guys. If you don't have an internet presence, you need one. Without the Goldfarb family's contributions to the school, and specifically their support of science and technology education, I wouldn't be here. And of course, you guys, the entire KO community. I cannot tell you what an honor it is to be back here speaking to you all. And by the way, when I was here in that chair where you guys are sitting, never in a million years would I have been thought about or elected to be the guy that would be on the stage down the road. So crazy things happen in life. I'd like to dedicate this conversation to somebody who most of you don't know. When I was here, he was an instructor, he was a coach, he was the interim athletic director, unbelievable mentor of mine, not only academically, just in life in general. He truly was one of my best friends when I was here at KO, and his name is Mark Doyle. So as we go through the conversation today, that's out of the 1978 yearbook. It's in the archives on microfilm or something somewhere. Most of you don't know him. Rob does, and some of the others do. But Mark, you're going to hear a couple of sort of lessons learned from me today. And Mark, I'm sure, would want to be here, but he can't be here. And the reason he can't be here is because not too many years after I graduated Kingswood, he died. And the reason that he died is because one of the habits that he had was smoking 2 packs of filterless Camel cigarettes every single day while he was alive. So at the ripe young age of 42, with a wonderful wife and 2 nice kids, he died at the age of 42 of lung cancer. So you're going to hear sort of a couple lessons I've picked up along the way, and we're going to start with that right now. Probably a good idea to not smoke. You just look around you, kind of see what happens, and you just sort of take those away. So I'm not going to ask for a show of hands if anyone in this room smokes, but if you do, you're probably not going to be able to come back and be in the audience or on the stage 34 years later after you graduate. So that's lesson number 1 for the day. The other thing I talked about a moment ago is that one of the reasons that I have the crazy sort of career path that I have is because of the way that I think. And I've chosen to share a portion of the way I think with you today, because if I shared the whole thing, it would probably scare all of you out of the room. But these are, I'm sure you recognize most, if not all, of the people on this particular slide. It really takes people who just view the world differently and think differently about what it is they see and interpret things differently than most people interpret, and don't rely on others to interpret the world for them, to really be game changers. And I'm not saying I'm a game changer, but I'm working on it. And each of you has the opportunity to be a game changer. There's nothing you can't do if you put your mind to it. And I'm going to show you a crazy real-world example of that in just a couple of minutes. So today's all about thinking differently. Ground rules. Speaking of thinking differently, do the guys all still have ties on? There's so many sweatshirts. Okay, so do I have a tie on? No. Is it because I'm disrespectful? No. If you knew me, you'd know that disrespect is not part of my being. The reason I don't have a tie on is because here's what I think. The thing that pumps the blood, medical school lesson, the thing that pumps the blood is down in this area. The place that sort of needs the blood to get to it, to think, is sort of up in this area. And there's this really narrow, tight funnel kind of thing in between those two. And so somebody's going to have to explain to me the benefit of taking a piece of silk, tying a knot, making it real tight, kind of like a noose, and constricting that area that gets this. You understand what I'm talking about? So, I don't remember the last time I've worn a tie. I don't plan to wear a tie. Debbie was nice, gave me a wyvern tie. I might wear it. I'll try to find a reason to wear it. But I've chosen a profession and a career where I don't have to wear a tie because I don't get the whole tie thing. In fact, just to finish that discussion out, doesn't it make more sense to put a tie on when you go to bed and take it off in the morning? Because you're asleep and your brain's not working anyway. So if you really want to wear a tie, just wear it at night and don't wear it during the day. I mean, anyway, so I'm not saying take your ties off, don't get in trouble, but most of you have already done this, so it tells me you're smart. Undo the button, pull the tie down, open up that constricted area, let the blood flow so you can listen and think. And of course, you're going to have a tie on when you get to your next class, so don't put it too far away. Cell phones and PDAs. This is huge. As you already know, I want your PDAs on during this conversation. Obviously, you're welcome to listen to what I have to say, but there's so much more going on in the world that if you don't multitask every minute of every day, the world will pass you by. It's the information age. You have information at your fingertips. So I talked already about it's probably a good idea to make it so it doesn't ring. The two things that will bother somebody near you, or take a phone call and have a conversation, that's probably not a good idea. But can you send a text? It's not going to bother me. Can you send an email? Can you update your Facebook status? Can you send a tweet out? So here's the challenge. If you send a text, send an email, update your Facebook status, and put a tweet out, and you receive a text back from someone not in this room, you receive an email back from someone not in this room, and someone responds to something you did on Facebook before the end of this discussion, that's a prize. Get to work. It's a prize. Get to work. It's all about networking. In the age of information, networking is huge. Your network defines who you are. By the way, none of those things apply if it's the person next to you. Don't text the person next to you. And then I already talked about multitasking. So this kind of brings up lesson number 2 that I want to share with you, and that is the ground rules. There really are no ground rules. Ground rules are only what you allow. So if somebody says wear a tie, it only works if you actually wear the tie. The biggest lie in the United States, and by the way, I drove up to Connecticut yesterday afternoon, and nowhere is this lie more apparent than in the state of Connecticut, my former home state, by the way. So 3 words that are the biggest lie in the United States. Anybody want to guess at what those 3 words are? Again? Yeah, that's 5, but yeah, that's a big lie. That's good.
I love you.
Who's your Matt? Yeah, that's... I love you too, but what's the answer to the question? No, those are all really good examples. The example that I was thinking of was speed limit 55. I think, first of all, I noticed when I got into Connecticut that maybe it has been, it's a statewide speed limit. So there's nowhere is the limit above 55, I guess is what that means. On any of the interstates in this state, I found out yesterday that if you drop down, if you dip below about 70, chances are good you're going to get rear-ended. So I know there's probably a driver's ed instructor in here that just had a seizure. I apologize, but it gets back to ground rules. So and don't miss the point here. The state mandated speed limit in the state of Connecticut is 55 miles an hour. But ground rules only work if people choose to follow them. What percentage of people choose to ignore the state speed limit? Probably 75 or 80%. So is that really an effective ground rule? The answer is no. So think about ground rules in that way. So here's the journey. I was asked to talk about my career path. I'm going to give it to you now, and the whole conversation would be over in about 8 minutes if that's all I had to talk about. So I've chosen to wove in a couple of other things. How are we doing on the social stuff? All right, good. My last audience was a little faster than that, but just saying. I was really wondering whether to put this up. This is what I looked like the last time I was in one of those chairs. I'm not even going to look at it. It's a little frightening. But anyway, so this was the beginning of my journey, starting with where you all are today. So I sat in one of those chairs, and in 1978, I graduated Kingswood. Interestingly enough, both of those songs have played on my car stereo, not recorded. It's just on the airwaves within the last 7 days of me coming here. And those songs are as old as the hills. And they still are pertinent in my life today. So apparently I somehow picked okay. Let me walk through the career path. and I'm not, this will be sort of the boring part, so update Facebook. So I graduated Kingswood, went to Trinity, phenomenal school, by the way. If it paid better, I'd still be there. I then was fortunate enough to get into a couple different medical schools. I chose one in Philadelphia. At the time, it was known as Hahnemann University, Hahnemann Medical School, then it was Hahnemann University, then it got acquired by Drexel, so the world of business will insert itself everywhere you go. So I went to medical school, couldn't decide what residency to do, so I became a family practice resident because it's sort of a rotating internship, so lack of a decision is really not a bad decision. I wound up loving it, and I practiced as a family doc for 10 years. As you heard, I delivered 100 babies. I used to make house calls only for people who were too sick to come into the office. And despite being a solo practitioner and starting my own business, I was told it was a dying breed. For probably every year I was in practice, I laughed all the way to the bank and had a wonderful time with my patients. I really had a good time. And by the way, just for the record, when I owned my own business in private practice, I think I stopped wearing a tie like on day 3 of my private practice because I was the boss, and that was my rule, no ties. So we'll come back to that. I left the practice of medicine to enter the field of health insurance. Specifically at that time, it was known as managed care. So I made a move that I thought was going to be a good move, and it was a large insurance company that did about $10 billion in revenue, and I really got an education about the whole financing of the healthcare system. I thought I could make a difference, be a doc on the side that was in control. And I had a pretty good, excuse me, I had a pretty good ride, met a lot of good people. I was there for 8 years and moved up the ranks and did well. But just like at the end of my private practice career, tell me if this happens to you, and hopefully it will happen to you, at least that's my hope for you, is at the end of 10 years of private practice, something clicked in my brain. And I had been through 10 cycles of cough, colds, and flu in the winter and delivered a bunch of babies. And I really had a good time in practice, but after 10 cycles of that, 10 years, I just thought to myself, there's got to be something else. There's got to be something more. It's time to do something different. And literally, it was Friday. It was at 5 o'clock in the afternoon. I remember sitting at my desk. I sent my staff home. I had done 29 hours of patient visits, which I enjoyed, and 29 hours of uncompensated paperwork, which I really didn't enjoy. And I thought, done. I'm on to the next thing. And it literally was like a switch. And I hope that switch talks to you in your life. And we're going to come back to that theme. Same thing, after 8 years in the health insurance space, I had done just about every job there was to do for a physician executive, had an impact, and there really wasn't much left for me to explore in that environment. And literally that same switch that had clicked earlier clicked again, and it was just time to do something different, which got me into healthcare information technology. And healthcare information technology has been a blast. Why has it been a blast? Does anybody besides me think that healthcare technology is an oxymoron? How many docs that you go to still have paper charts? Probably 2/3. Paper. How about if you travel overseas and get sick? What kind of access to your medical record do you have? None. I mean, it's unbelievable. You can, I was with my parents, we traveled to Rome a couple years back, as is typical when you have 4 kids. I ran out of money halfway through the trip. And so I went up to one of the ATMs. I do not speak Italian. I do not read Italian. But I recognized the buttons. And I put my card in and hit the pin and prayed that some money was going to come out. And sure enough, that thing in 60 seconds on a sidewalk in Rome had found my bank account here in the United States, converted whatever number of dollars is 500 euros, and it's more than 500, and handed it to me on the sidewalk in 60 seconds. And I thought, wow, this is really cool. It found my money and it gave me some. I wonder who else's money it could find. I didn't do that. That was a joke. And then I thought to myself, if I turn and fall off the sidewalk and break my arm and wind up in the emergency room and hand them my health card, will they be able to find my medical record and find my allergies and find my medicines? And the answer is no way. So anyway, long story short, I went into healthcare technology, and I've been in healthcare technology ever since, and it's great because it's wickedly broken. There's so much opportunity for improvement for technology in healthcare. It's job security for me and a whole bunch of other people, maybe even some of you. And it happens to be a lot of fun because you can take existing technology that works really well, some of which you guys are working on at the moment, I hope, and leverage it to improve health of the world's population. So we're going to get to that. So let's see, I was the chief medical officer of a couple different technology companies. I then did a year at McKinsey. I was part of the International Health Systems Institute, which means I got to travel and study health systems around the world, which was really neat because the US health system not only is different than most other countries' health systems, but it's also more expensive and the outcomes are no better. So there's kind of a lesson in there. That's the window of opportunity for us in the US. And then I finally got to an interesting situation. So let me tell you about the situation. So I'm in this thing at McKinsey, which is a good company. And a buddy of mine calls me up, this then 21-year-old CEO who started a company, left Brown University after 3 semesters, started a company, and his goal was to take social networking and apply it to a healthcare population for better health outcomes. And I was like, wow, how do you argue with that mission? And I looked at what he was doing, I looked at what he was capable of doing, and looked at the people he surrounded himself with, and I really just looked at the mission. The mission just made a lot of sense, and I thought, you know what? It wasn't a decision to go to work with Grant, who you'll meet in a moment on a video. It was really a decision that if it went really well, and I passed up the opportunity to go do that, I would be kicking myself. So I wound up joining. That was 17 months ago. And I'll give you a little bit of detail around how it's going. Because that, I guess, is probably why you're really here today. So I probably ought to talk about that at some point. But it's really pretty neat. So here's, I think, what I'm going to do. Let me see what slide. I don't remember what slide I have next. Yeah, so if you look at my career path, I've actually been with 5 healthcare IT companies in the last 8 years, so you can do the math. So I have a little bit of career ADD. If you look at my resume, you'll either come to one of 2 conclusions. Either I can't hold down a job, or I wound up at the place that I eventually was sort of destined to be, which is kind of what I'm thinking. We basically are using social networking, gaming. Anybody know how many individual internet gamers there were around the world last calendar year, new to playing games? Anybody know the number? You all familiar with Farmville and all that kind of from faith, yeah, right? 4 million? 400 million? Well, sold to the person with 1 billion. 510 million new internet gamers last year, 2011, averaging the top 5 games on, which are all Zynga games that are in Facebook, Farmville, Cityville, all those, net $1 million a day of marginal additional revenue, and the majority of that revenue goes to virtual goods. Do you know what a virtual good is? A virtual good is nothing. It's a bunch of electrons on a screen. You buy a green tractor in Farmville instead of a pink tractor because it plows more land, but you get nothing, and real dollars are being spent on that. Why do I share that with you? If you game, great, don't pull your credit card out. But there's some kind of attractiveness of that. It's gotten the attention of a lot of people around the world. A lot of people are doing that around the world. And then there's this other thing called artificial intelligence with a recommendation engine. How many people are familiar with Amazon? Netflix. Ever heard of any of these? Ring any bells? So don't you love it when you log on to any kind of website? Thank you. I get my fan clubs in the back row. That's good. You guys have energy. I'll be back there in a minute. Your favorite thing, apparently, when you go on a website is not welcome back to, whatever, Netflix. It's welcome back, Henry. Ooh. Based on the last movie you saw, you probably ought to see this one. Ooh. Turns out 2/3 of Netflix movies are based on the recommendation engine. In other words, people go on the site looking for a movie and they wind up not with the one they were looking for 2/3 of the time. That's how powerful the recommendation engine is. Amazon, the year Jeff Bezos introduced his recommendation engine to Amazon, in a declining economy, his gross revenue went up 20%. Huge in the internet sales business, huge. And that was all due to the recommendation engine. So apparently human nature loves to socialize, loves gamesmanship, and will spend money on it, and will basically enjoy being served up suggestions on a very individualized basis, to the point where people now buy things that when they jumped online they didn't know they needed. It's a very powerful force. So what we do in our company is we say, okay, we'll take all 3 of those forces, and instead of getting a population to buy something that they didn't need, let's get them to do something that results in a better health outcome. Let's get them to eat better, exercise more, take their medicine, see their doctor, do their preventive health screenings, all that kind of stuff, and use those tools to get people, because nothing else has worked, quite frankly. And so we're very hopeful that this worked. That's the concept. I have a couple-minute video. Before you roll it, Mark, we're going to switch over to a video that I'm going to show you. On the surface, it's an interview of me talking about the company. But what I want you to, you can listen to what I say, and that's fine. But what's more important is I want you to pay attention to the environment